Hey, Dr. Wilder, coming here to you again from one of my daughter's bedrooms as I'm working at home today for the mid-August COVID update. I don't know about you guys, but I am blown away that we are already halfway through the month of August. This year is going super fast, but in many ways it cannot go fast enough, right? I'm super excited to announce that LifeScape has once again, for many, many years, been selected by Concierge Medicine today as one of the top 25 concierge docs in the nation. So I can't even tell you what an honor this is to be recognized, particularly among an incredible group of inspiring and revolutionary colleagues. I don't know if you remember, but many years ago, I think right around when we started our concierge program in 2008, Mike Huckabee was running for office and said something to the effect of, "Mark my words, in 5 years, your doctor will be in concierge medicine or God help you medicine." And now, with the health of our nation in absolute peril, now more than ever, patients need proactive, preventive approaches to actually optimizing their health and their family's health. And they also need dependable, accessible advocates to negotiate this crazy and complicated healthcare system. So, LifeScape more than ever, I think is our mantra of this year. So a quick COVID update, United States is up to at least 5.2 million cases in the US, over 167,000 people dead. Maricopa County and Arizona, over 127,000 cases and over 4,300 dead. And fortunately, we are seeing the cases declining. Unfortunately, still many people are having struggles getting tested, or they're not testing in certain situations, such as cardiac events, home deaths, things like that. Certain jurisdictions have decided that they don't want to test because they're concerned about case numbers hurting their economy. So, as I said before, denial is not a strategy here, that we can't magically think that close our eyes, this is gonna just disappear. We just had a little COVID scare in the family with one of our daughters having some symptoms, and the struggle to get testing was really, she doesn't live here in the area, so we couldn't test her. We have rapid testing available for our patients and their close contacts, but getting my daughter tested out of town was a huge struggle, and that's a very scary thing. And getting a result back in 7 to 10 days is not okay. It's not useful. It's not at all valuable. So that we've got a long way to go yet in terms of adequate testing. I think it's important today to talk a little bit about when the public health department talks about 3 levels of transmission: substantial, moderate, and minimal. And certainly we had that run-up COVID surge and experienced what exponential growth can look like with a virus that's this easily transmitted. We're now still in the moderate transmission range, and to reopen safely, and this includes schools, gyms, restaurants, etc., we're supposed to meet 3 specific criteria for 2 consecutive weeks. Currently, I am hearing about schools opening in person while no Arizona county meets all 3 of these criteria. And those criteria are: new cases per 100,000 need to be below 100 per week. Maricopa County is still over 2,800 per 100K. The case positivity rate needs to be less than 7%. I believe we're somewhere between 11 and 13%. And hospitalizations need to be less than 10% of cases. And I think we're still at about 11%. We are definitely still on a downward trajectory in terms of cases. We've seen a little blip in ventilator use and some other parameters. I watch the hospitalizations particularly closely. But what this shows is masks works. I mean, they truly work. But what happens if we prematurely open schools, gyms, bars, restaurants, and we haven't met these guidelines? Well, we've done that already. We did it in early May, 2 weeks before we had met any of those same criteria, and we had the hottest COVID spot in the planet. So do we really want to go there again? I don't know about you, but I don't want to go through that again. However, here's the exciting thing. We could crush this virus if just for 6 weeks, everyone in the country masked up, stayed distant, avoided gatherings of over 10 people, and just played it smart. We could do this. As I've said before, this is a war, and our best contribution to this war effort is to not get sick. So please mask up, stay safe, be smart, because I know we can do this together. So speaking of masks, a little bit more nuanced guidance came out of a study from Johns Hopkins showing, as we expected, N95s and surgical masks, which are now much more widely available. I've even seen them at Costco or other pharmacies. They're the most effective at preventing droplet spread to others. So again, we wear masks for two purposes, somewhat to protect ourselves, but also to protect others from just the spray of speaking, which can infect other people. Multi-layer fine weave cloth, like quilting cloth, is also excellent. If you can add a filter, even better. But unacceptable include any mask with a valve. Again, that is an export valve saying, I'm okay to infect you, I'm just going to protect myself. 2-layer bandanas are not at all protective. They're about equivalent to nothing. And they're also not closed underneath. So they don't contain really any droplet spread. And worst of all, unfortunately, I thought these would be good, but the single layer fleece buffs that people can just pull up over their face actually magnified the aerosolization of particles. And so they were worse than wearing nothing. That's not a good thing. So we need to talk a little bit about aerosols, because there's been a huge debate in medicine about, is this virus spread by aerosol? So the difference between aerosol and a droplet is droplets are, what we kind of spray out when we speak, and they fall quickly to land on surfaces and stay on surfaces and may be infectious for a little while on surfaces. Aerosols are vaporized. Basically, they're in the air. They can float around. We know, for example, measles, which is one of the most highly transmissible viruses. You could walk into a room 8 hours after a measles case left and catch measles from the virus aerosolized in the air. So it wasn't really clear that this was the case with COVID. It certainly, there was data before and against, but and it's clearly not spread as easily as measles. But there's a study about to be published that isolated live virus from the air of COVID case patient rooms, despite 6 time per hour air exchanges with HEPA filtration and UVC decontamination. So that is very concerning for likely aerosol spread. Some of the studies on the ships, the Diamond Princess, where they were able to isolate live virus 17 days after people debarked from that ship, also worrisome. And we've always been concerned in the clinic about the possibility of toilet flushes just aerosolizing virus, because we know that this virus can be isolated from stool, from sewer systems, things like that. So that's some concerning data that we will kind of keep an eye on. Let's see. And it has huge implications for closed classrooms with groups, indoor dining at restaurants, working out at gyms, dental procedures where you may be aerosolizing saliva. So, I mean, and bottom line is to crush COVID, keep a mask on, stay spaced and safe. And outdoors is much, much safer than in, if it weren't for the blistering heat, unfortunately. It's very pleasant between 5 and 6 a.m. though. And pools are safe if distancing is maintained. So, word about exercise and gyms. When working out, think about it. You obviously expel much larger volumes of respiratory particles, and they're expelled further and more forcefully. So 12 feet of distancing is recommended for working out in gyms. So please, please avoid working out in gyms that are not requiring masks when working out, or that don't allow for safe spacing, especially from cardio machines, or they're not doing diligent wiping down of equipment between users. Now, bottom line, your single most important factor beyond protecting yourself in surviving COVID is your baseline health. And this is what we really try to emphasize every week. So make sure you attend to your preventive care. Get your vaccinations, especially those for other respiratory diseases like pneumonia, influenza, pertussis, the Tdap booster if you're due for that. And we've developed a little quiz we'll be putting online that assesses how healthy is my immune system. So your goal on this quiz is 15 questions, 1 point for each. Your goal is to get at least 12 points. So I'm going to run through it quickly. We'll put it online eventually, but just assess yourself for a second. So how healthy is my immune system? Number 1, I get 7 to 8 hours of sleep every night and wake rested. Number 2, I practice a daily habit for managing stress. Number 3, I eat plant-based, high fiber, at least 4+ cups of veggies and 2 fruits a day. Number 4, I avoid sodas, sweetened beverages, or fast food. Number 5, I minimize alcohol. Number 6, I exercise at least 150 minutes a week. Number 7, I never smoke or vape and avoid any tobacco exposure. Number 8, my weight is healthy with a waist circumference less than hips. Number 9, I never take antacids or acid-blocking medicines. Number 10, I never take anti-inflammatory medicines like ibuprofen, Aleve. Number 11, I have not taken any antibiotics in the past year. Number 12, I have a normal blood sugar, less than 90, not prediabetes or diabetes. Number 13, I don't take immune-suppressing medicines or prednisone, steroids. Number 14, I'm not on any chronic medication. Number 15, I take excellent care of my teeth and gums and avoid mouthwash. So again, if you score over 12, you're an immune superstar. 8 to 11 is sufficient. It's good enough for government work, as we used to say. 7 or less, it is time to get in gear, and I would strongly encourage a virtual health coach consultation with our nutritionist, functional medicine rock star Dana Bosselman. She is available to any patients. You do not need to be a LifeScape patient to have access to Dana's services. So please consider a consult with her. If your score is less than 5, I would strongly encourage a functional medicine consultation. 30,000 foot, very, very comprehensive assessment on how can we move your health from here to here. Also letting everybody know we should have flu vaccines available next week. We'll announce to our patients when they're available. We encourage everyone to get vaccinated as soon as possible. They are available at some of the pharmacies already. If you are over 50, I would encourage the higher dose flu block vaccine. Over 65, the highest dose flu vaccine. There is some data that taking the medication metformin may actually improve flu vaccine efficacy, but that's something that really should be discussed with your medical provider. There's some really interesting immune and aging deceleration effects of metformin. There have already been flu cases reported in Arizona, and with some schools opening in person next week, I am very worried about this, although I'm hoping the masking, the hand washing, and all of the things we're doing for COVID will also keep our flu cases very low. You do not want to get both the flu and COVID. It can happen simultaneously, and the flu is still very lethal. Over 40,000 people a year die from influenza. And different people are at risk of that, especially pregnant women, young children, and of course the elderly. Please fact check any blogs you're reading about the risk of flu vaccines and COVID-19. There is no definitive data that the flu vaccine increases your risk for COVID-19. There have been some associations in an occasional study that people seem to get more colds with some other coronaviruses. That does not mean that the flu vaccine caused that problem. These are theories. These have not been proven. And I and most other physicians out there do not believe that that's a risk. I will continue to have my flu vaccine and make sure my family and people I care about are vaccinated. We also have rapid COVID antigen testing. I mentioned that for our patients or their close contacts, and multiple testing options for our patients, a variety of antibody tests, etc. So check out our COVID-19 resources page on our LifeScape Premier website. I'll also note that the Red Cross is offering free antibody testing with any blood donation, so please go donate blood. Number one, most important, take care of you. Thank you for being here for us, and please spread the word. Thanks. Have a great week.